Picture this. A new mother arrives at a rural clinic in Rwanda. She's hemorrhaging after giving birth. The nearest hospital with a reliable blood supply is hours away by road. Rivers, winding dirt tracks, and potholes are everywhere. In the past, she might not have survived the wait, but today, a nurse makes a phone call. Minutes later, a small red and white drone buzzes overhead, releases a package with a parachute, and within half an hour, the mother has the blood that she needs. This isn't science fiction. It's Zipline, the world's first large-scale drone blood delivery system, and it's reshaping how we think about logistics, healthcare, and engineering for equity. Zipline was founded in 2014 and launched its first national service in Rwanda in 2016. The goal was to bypass broken supply chains by delivering health products like blood, vaccines, and medical supplies directly to hard-to-reach communities. By 2023, Zipline had flown millions of kilometers and delivered thousands of units of blood to Rwanda and Ghana, and was even branching out to other countries. The cost per flight was competitive with traditional road transport, but the speed was dramatically faster. For many, Zipline became a symbol of African innovation. It represented solutions not just being imported, but being effectively deployed where the systems needed them most. Rwanda's Minister of Health even once described it as leapfrogging into the future of medicine. The story of Zipline is clearly inspiring, but I think it also shows us the limits of technology. First, drones solve what's called the last mile problem. They can deliver blood to rural clinics in minutes instead of hours, but they don't fix the underlying shortages of trained and available health workers, of clinics with basic medical supplies, or of blood supplies in the first place. A drone can't replace a doctor, and it can't generate electricity for a refrigerator. If you watch one of the predecessor videos to this one, you might remember that one of the traps keeping the bottom billion stagnant is a lack of infrastructure. So if we don't have the roads to get ambulances or emergency vehicles in general between major city centers and the last mile, how are people en masse getting back and forth? They're generally not, right? Which means these people have limited access to larger hospitals, major trading centers, educational facilities, and more. Second, there are questions of equity. Drones are highly visible, they're very exciting, so governments and donors love the publicity. But this can risk diverting attention away from more fundamental investments, like ambulances, laboratories, and sanitation systems. Technology is seductive, and sometimes it makes us forget the basics. Third, there's the issue of sustainability and dependency. Zipline is a private company. If government contracts end, or if donor money dries up, what happens to this service? Can lower-income governments afford to scale and maintain such systems without external support? Finally, there's community trust. Believe it or not everyone warmly welcomed a flying robot dropping packages from the sky. A lot of people had questions like, what are in these packages? Or are we being spied on? I know similar conversations were happening in my community when Amazon was piloting drone delivery. Adoption of Zipline drone technology required careful education, storytelling, and collaboration with local leaders to show that drone delivery was both safe and useful. But despite these challenges, the results are real. Studies in Rwanda and Ghana have shown that maternal mortality by postpartum hemorrhage has dropped by over 50% in districts covered by Zipline. Delivery times used to be 4 to 6 hours by road, but by air, sometimes they're under 45 minutes. But the data also shows that drones work best when paired with already strong health systems. Clinics that already had trained staff and basic health equipment benefited most. Where the foundation was weak, a drone delivery system couldn't fix everything, which is why the World Health Organization called drones a complementary tool. They're very powerful, but they're not a silver bullet. I sort of think of Zipline as a clever patch in a larger engineering system. If you have an electrical circuit with a bottleneck, you can add a bypass, sort of like a shortcut for the current. This is sort of what drones are. They're a bypass for the bottleneck of bad roads, limited vehicles, and slow or wasteful supply chains. But a bypass doesn't repair the underlying circuit. Eventually, you need to redesign the whole system. Stronger health networks, better infrastructure, and smarter resource allocation. Otherwise, you risk overloading the patch. On the ground, the impact feels immediate. One nurse in Rwanda said, "Before, I would watch patients die because blood never arrived. Now, I can make a call and save a life." But another health worker in Ghana added perspective. "Drones helped, but we still lose patients when we don't have oxygen or when there aren't enough trained staff." I think the combination of these voices remind us that technology only works when it's embedded in trust and relationships and human systems. Amartya Sen, in Development is Freedom, wrote about this concept that freedom isn't just an end of development, but also one of its principal means. That is to say that freedom itself is a crucial tool in achieving more freedom in the development space. Zipline isn't just about drones, it's about expanding the freedom to live, the freedom to access healthcare, the freedom to not die from preventable conditions. These work synergistically and they're mutually reinforcing. And these freedoms are instrumental in achieving further freedoms, like the ability to participate in economic activity and access to resources, and the freedom of mobility. Of course, there are critics. Some will point out that drones just look like flashy toys for billionaires. They'll ask, why pour money into high-tech gadgets when people still lack access to clean water? I think it's a fair challenge, but I also don't believe that this has to be either or. Drones are tools. When integrated wisely, they complement the basics instead of replacing them. The real failure isn't in using drones. It would be in believing that they're the whole solution. Personally, I truly believe that we need top-down policy changes to really start to tackle the underlying systemic issues at play here. But as an engineer, these sorts of technologies are my bread and butter. These are the types of things that people with my skill set can actually work towards building. People with political and economic and international relations backgrounds are doing fantastic work in the top-down direction. But the rest of us, with backgrounds in psychology and sociology and marketing and engineering, really can do so much from the bottom up to supplement their work. So, are drones the future of healthcare? Not entirely. But I think they serve as a powerful reminder that innovation can and should serve those who need it most. The lesson is simple. Technology must be designed not as a spectacle, but as a service. A drone is just a flying machine, but in the right system, at the right time, it becomes the difference between life and death. So here are my 3 takeaways from the Zipline story that I hope you, as someone who's also interested in this sort of technology, can find some value in. Number 1, think about what innovation means. It's not necessarily about the flashiest technology. It's about solving real bottlenecks for real people. Number 2, before celebrating a solution, ask whether it builds a long-term, sustainable, and maintainable system, or if it's just a short-term patch. And number 3 is to really think about context and value it when evaluating a solution. Zipline started in Silicon Valley, right? And drones in Silicon Valley are just toys. But in Rwanda or Ghana, they're a lifeline. Zipline teaches us that the future of medicine isn't just high-tech. It's about designing systems that value every life, no matter how far from the capital city or how rough the road to get there. And if you're still here, thanks for watching.